So you have your coronary arteries along with your coronary veins on top of the heart. You have your aortic arch right here. Off that aortic arch, you have two branches. The first large branch, get that lung out of the way, is your brachiocephalic. The second smaller branch is the left subclavian. Usually the first branch going down, as long as it's going down and then you notice it starts to move up along the back, that is going to be your vertebral. And then either right across from it or a little bit ahead of it, you're going to have your internal mammary, which would run along the sternum. That's left subclavian is then going to turn into your thyrocervical artery, which continues up into the neck to go to the thyroid. And off of that thyrocervical, you have your transverse scapular, which goes down to the shoulder. The second branch is your axillary after it leaves the ribs. And then that'll continue down till you get to the subscapular artery, where it will turn into the brachial artery, which continues down into the arm. Going back to the aortic arch, you have that brachiocephalic artery, which at this point right here branches into three. The first branch is your left common carotid that will go up the left side of the neck. The middle branch is the right common carotid, and it will go up the right side of the neck. And then the third branch would be the right subclavian. Off of the right subclavian, again, you have another internal mammary. And then right there would be your vertebral. Again, remember it's going down, but then it starts to move back up. Sometimes there's some arteries that cut across that just go straight down. That wouldn't be a vertebral. It's one you don't have to know. So then once that right subclavian leaves the ribs, it becomes the axillary right here until you get to the subscapular artery, where it then becomes the brachial, which will continue the length of the arm to the elbow. Okay. You then have your descending aorta, which comes off of the aortic arch and continues down the back. You have your lumbar arteries, very thin, that are going to the vertebrae. Your first branch that you need to know anyways is your cephalic trunk. Off of that, you have three other branches. You have the first branch being the hepatic, which is going to the liver. The second branch is the gastric, and it's going to the stomach. And then continuing up, you have your splenic, which is going to the spleen. The second large one here is your superior or your cranial mesenteric artery. You then have an adrenolumbar that's going to the adrenal gland. Mine's torn, but it's that guy right there. It should be attached to the descending aorta. And then you have a renal, one on each side, going to the kidney. The gonadal arteries are really thin, but in this case, since it's female, it's going to the ovaries, one on each side. If I had a male, they'd come off the side, move down the back of the body, and go to the testes. You then have an inferior mesenteric as well. I'm pretty sure mine's torn, but it would have been right here going up to the large intestine down here at the bottom. I think your book might call it the caudal mesenteric. You then have your iliolumbars coming off the sides. And then the descending aorta has that first split, which is the external iliac. The descending aorta will continue down a little ways till it splits again into your two internal iliacs. And then there'll be a median sacral, which is in the center, if I can get it, right there. And that goes to the tail for the cat. Your external iliac is going to continue down till it branches. And that first branch will be your deep femoral, which is right there, the pink. And then after that, it's not the external iliac anymore. It becomes the femoral artery right there, until that's going to split into your saphenous, which is this thin one here that's going to run the length of the leg to the ankle, and your popliteal, which goes to the knee.